Hi guys. Okay, so we are going to be covering hemothorax in this video. Okay, if you have not watched the previous video, Everything Pneumothorax, please watch that first. Okay, it goes over pneumothorax, it goes over tension, pneumothorax. So watch that one first and then watch this one. Okay. So we're going to talk about a hemothorax, and a hemothorax, apply everything that you've retained from the Everything Pneumothorax video, and now let's get into this, okay? So the pathophysiology behind a hemothorax, okay? This is blood in the pleural space associated with trauma, okay? It's associated with trauma. This is a life-threatening hemodynamic and respiratory compromise. This has to do with bleeding, okay? This is a collection of blood in that pleural space, okay? The space between the visceral and the parietal pleura, all right? And it is associated with traumatic thoracic injuries from either blunt force trauma, a penetrating injury into the thoracic cavity. Okay, so a hemothorax will result in hemodynamic and respiratory compromise. Okay, hemodynamic because it's blood. It has to deal with blood. And respiratory compromise because blood should not be in that pleural space. Okay, it is an immediate life-threatening disorder or injury, okay, caused by blunt trauma. Okay, I can't stress it enough. Hemothorax changes the hydrostatic pressure, okay, and it increases and puts greater pressure on the vena cava, all right, which causes an increased pulmonary vascular resistance, okay. So, main things I need you to know, okay, a lot of the times a hemothorax comes from blunt force trauma from motor vehicle accidents, okay, usually about 80% of them comes from this, all right. Hemothorax is the result, and it can lead to death very quickly, okay? The impact that it has on overall health is lower normal, for the aging adult, lower normal oxygen levels, rigid chest wall, decreased lung capacity. I kind of said all of this, is just reiterating from the last video. So when you have blunt force trauma, or when this occurs, your other thoracic structures are put at risk, okay? The conditions that can arise from chest wall injury, rib fractures or flail chest, cardiovascular injuries, or cardiac contusions, okay? Lack of seatbelts when riding in a car or driving impairment due to alcohol and drug use, okay? These can also be contributing factors for a hemothorax, or the cause of motor vehicle accidents that could lead to the hemothorax, okay? So educating your patients on the development of like healthy lifestyles, staying away from alcohol, don't drink and drive, don't do drugs and drive either, okay? That is very key, okay? Always wearing a seatbelt, all right? Key things. So what are our patients going to look like? It's very, very similar from the video, the Everything Pneumothorax video that that you watched prior to watching this one, because you're going to watch that one first. If you have not watched it, go back and watch that one and then come back. Okay, but your manifestations of your hemothorax are same as like your pneumothorax. You're going to have respiratory distress, dyspnea, shortness of breath, okay? Blood in the client's lungs that displace the air, okay? That's a big one. Tachycardia, tachypnea, decreased or absent breath sounds. That's still a thing, all right? There will not be any jugular vein distension with this, okay? No JVD with a hemothorax, okay? They will have blood in their lungs displacing the air, impacting their lung capacity, okay? Your hemothorax manifests as decreased breath sounds and manifestations of shock, okay? Shock, keep that in mind, shock. The loss of blood into the chest cavity results in manifestations that are associated with your blood loss, okay? Think of blood loss and hypovolemia and shock, what that looks like. Tachycardia, tachypnea, diaphoresis, cold skin, okay? Keep that in mind. Don't forget your signs and symptoms and your manifestations of shock, okay? Think blood, bleeding out, low blood volume because it's pulling in one area in the body, okay? Chest x-rays is usually the initial tool to diagnose this, and evaluate this. It is a thoracic injury, so we're going to use a chest x-ray first, okay? It could then be followed by an ultrasound and CT, okay? Like the pneumothorax management, a hemothorax will have a chest tube, okay, which involves a chest tube drainage system, or even a thoracentesis, okay, sticking a needle into that cavity and drawing out the fluid, all right? But the ultimate goal for this is expansion of the lung to resume proper functioning, okay? Stop that blood, that pooling, okay? Get that blood out of there, all right? So that the lung can re-expand, all right? One other thing that I wanted to touch on too about your chest tube draining system, there should not be any bubbles, okay, in your water still chamber, all right? Water still chamber should not contain any bubbles, okay? If there are bubbles in that water still chamber, okay, that can tell you that there is a leak, okay? There's a leak in your system, and that you need to evaluate where is the leak coming from. Maybe the tube is not all the way into the patient and sealed off properly. Maybe the tube that's connected to the wall to promote suction is not hooked up properly. So you do need to be aware of that and to assess that, okay? So your role as the nurse, that is part of your role, assessing that drainage system, okay? Environmental factors, okay? Fear due to the dyspnea and the pain, that anxiety. I touched on that. I tell you guys that. I've told you that. I mentioned that in every single video, okay? Be mindful of that for your patients, okay? Recognize the severity of the client's condition, okay? This is an emergency, a life-threatening emergency, and it requires immediate intervention, okay? They will be immediately admitted into the hospital, okay? You also want to involve the client or the patient in their chest tube drainage management. You want to teach them and stuff, about it and what you're doing, okay? That will also help to relieve some of their anxiety. Respiratory monitoring and also supportive care to your patient and the family, okay? So that's pretty much it for a hemothorax. It kind of follows suit with the pneumothorax, just a little different because it involves blood, okay? Blood and bleeding. So I needed to reiterate that shock and stuff to you, okay? Happy studying!